Good morning. Good morning. How's everybody doing? That's good. And you're still at the contractors in here?
No, not exactly.
Okay.
There is a
They wear the same colors no matter what.
Okay, do you have symptoms of respiratory infection, fever, shaking, chills, cough, shortness of breath, severe sore throat, loss of taste or smell, and muscle aches?
No.
Hi, Wendy. Thank you, Wendy. Wendy, questions. Do you have symptoms of respiratory infection, fever, shaking, chills, cough, shortness of breath, severe sore throat, loss of taste or smell, and muscle aches? No, ma'am. And have you been in close contact with 6 feet for more than 5 minutes with a person with confirmed COVID? No, ma'am.
This was the Kent County.
Restrooms around this corner, training's inside. Perfect.
2010.
The ones I'll be on are like, I try to catch the 9s.
96.5.
And then,
I think it was like 30,000. So like whenever we went to AI, we would wear
96.5.
Probably.
First name? Jeff? Oh, Josh, okay. Josh, 2 questions. Do you have symptoms of respiratory infection, fever, shaking, chills, cough, shortness of breath, severe sore throat, loss of taste or smell, or muscle aches? No. And have you been in close contact within 6 feet for more than 5 minutes with a person with confirmed COVID? Okay. Training's inside, you can pick a station, and restrooms are around this corner.
Okay. So you got it.
So that is the most important thing I want you to hear, and I want you to take it back to your families and say thank you on behalf of me and all of the citizens of Delaware, because if they didn't stay healthy, you wouldn't have stayed healthy. So here we go. So again, I want to thank you for answering the calls. You stepped up. This is all new. Understand, this is a classic new environment, if you will, for all of us. We've been dealing with this battle for about 8 weeks here, and we really we're doing very well. The state is doing exceptional. If you look at the big numbers nationwide, the state of Delaware is doing a great job, and our partners in the state agencies, primarily Health and Social Services, who have the lead on this, they've got it, right? They've figured it out, and the governor is supported by the science, and Delaware as an entity is really in good shape. Now, we recognize we've got some challenges. We've got some spikes going on. We need to get some education out there. We need to get some testing done, and we need to get some data going on, right? So we've had guardsmen on doing some medical missions, working in assisted living community, working in some of the other state agencies, doing some medical things. We're doing points of distribution with school meals and the food bank of Delaware all over the state. So we've been out there, but we've been out there in a pretty small footprint right up until this morning. And our footprint just pretty much almost doubled this morning, and by the end of the week it will. So, and that's where you all come in. Thank you. That's all I'm going to, hit that with, and really focus on the importance of what you're going to learn over the next couple of days, and then the importance of where you're going. And I trust me on this. 20 years from now, you're going to be going, I was part of that. I was a part of that, and I was an important part, because you are. And it has been proven time and time again, and I'm not a scientist, so I don't want to step on anybody's toes here, but all I have been briefed is the way to beat a pandemic is through contact tracing, or COVID mapping, if you will, or the mapping process, because it encourages folks that don't even know they've been exposed to go get tested, and then if they're positive, they can go into self-isolation, right? So that's the importance of this thing, and you're going to cover down on. By the end of it, you're going to be making so many phone calls and so much data entry, it's going to wear you out. But that's where this is. Don't downplay what you're doing. This is a really big deal. And so again, I wanted to thank you. Do we have any moms in here? Raise your hand if you're mom. Happy Mother's Day. Thank you. Thank you, Mr. Bartell. Thank you, Colonel Benson.
No, please. So we're going to go through it. We don't expect everybody here to be a public health expert, right? We're going to get you some foundations, and then we're going to give you some tools, and then we're going to get you an opportunity to really contribute to a big problem, okay? So all I ask is that everybody pay attention, focus as best you can. If you got technical questions as we're going through, we'll work through those. I expect there's going to be some hiccups, right? I don't know where you're gonna be working, right? So we know we're gonna be working out of Del Tech. The intent is to create kind of a virtual environment.
About how you guys have the tools you need to do the best job possible. I just want to real quickly talk about what it is that we're doing, right? So that we're all on the same page. And again, I think we have some public health people, but not everybody's public health, which is totally fine. When someone is determined that they're positive, COVID positive, that person is a case index, right? That person is a positive person. For the first time, we're going to start asking those folks, who are they in contact with? Okay? All of those people will be what you do, right? So they may be asymptomatic, but they may have had exposure, right? So our job will be to be reaching out to those people who have been exposed by those who are COVID positive, right? Those are called contacts, okay? The other thing that we'll be doing is monitoring them over a 14-day period of time. So once someone is considered that they've had exposure from someone who's COVID positive, right, then your job will be making sure that they can self-quarantine for 14 days, right? And then over that time when you're monitoring, if they become symptomatic, they'll need to get tested, right? If they're asymptomatic for 14 days, you know, and we'll make sure we provide all of these protocols and workflows for you. The concept around contact tracing.
Yes.
You cannot open a state without contact tracing. Started. I did this assessment earlier, but now more people have joined. How many of you are Delaware residents? Raise your hand. How many of you are Maryland residents? And how many of you are from other states? Okay. How many of you speak another language other than English? Woohoo!
Oh, wow.
How many speak Spanish? Raise your hand. Oh my gosh.
Excellent.
Any other languages? Okay. So believe it or not, that matches what the needs are of the state at this point. It's Spanish and Haitian Creole. There will be other languages in which we're going to be needed to use a language interpreter, but we'll talk about that later. But we're really, really glad for those who speak Haitian Creole and Spanish. Really, really big, important piece here.
Volunteering for this mission. Several things. It's been mentioned, if you've heard on the television, you have testing, contact tracing, and mitigation. So, as mentioned before, the role that you're playing and will provide to the citizens of the state of Delaware will be very important. I might need you to be down in Sussex County or in Kent County in Dover. Okay? We're going to try to meet the needs of everyone as much as possible. However, mission dictates. Okay? So I might need you to be a little bit more flexible in that sense. Okay? Also, in terms of, leadership and rank and all that, everybody's getting trained, so everybody needs a plan to be on the phone, regardless of rank. This is a mission where we need all hands on deck. And this will evolve a little bit more, and we'll have, by the end of the week, we'll let everyone know which sites they'll be working out of. I'll just tell you right quick, at this point, subject to change, but it looks like we're going to be working out of the Delaware Tech Community College campuses. So we'll be in each county. And I'll tell you right now, we're going to start down at Owens and Georgetown, and then the Wilmington campus or George campus, downtown Wilmington. Those are the starters. And then the next week will come on and we'll phase out. Thus, the flexibility. We might have to lift and shift personnel. Okay? So, if you have anything of me, let me know. Any quick questions right now? All right, with that being said, I'm going to pass around this list. It has your rank name, what county you reside in, or even if you live external, just put Pennsylvania, Maryland, Virginia, whatever, phone number, and the additional language that you speak or languages, okay? And then also the email. So I'm just going to pass this around. Anybody have any questions for me right now?
No, sir.
All right, thank you. I'll be in and out of training, and I'll hand it over to the lady for the training. Thank you.
Thanks, sir.
Shoulder and like assembly line type settings, so that we can target those high-risk areas.
Until we have treatment and vaccine, contact tracing is going to be one of the most important tools we have in public health to help keep this infection contained.
So what we're going to do today is we're going to actually take you through a bunch of online modules on your own computers. There's a really good class that is through an organization called ASCO. What's the name again?
Association of State and State Territorial Health Officials, ASCO.
So they created a really good online module. So I wanted to go through what the week is going to look like for you, okay? So today, you're going to be doing these online modules, and you'll get a certificate at the end. You're going to have to pass some quizzes. So Cassandra was saying, you might need to write some things down or whatever. It took her a little while to pass some of the quizzes. So you're going to get, at the end of today, if you've gone through all the modules and you've taken the quizzes, you'll get a certificate. That's part one. So we're going to have our head EPI and our deputy EPI come and talk to you specifically about the workflows and what's expected here in Delaware. And then they're going to actually walk through some scenarios with you. They're going to introduce you to the online system called RedCap. And when you fill out that piece of paper that has your emails, we're going to send that to them so you can start getting an account set up through RedCap, okay? RedCap is the IT platform. So basically tomorrow will be when the EPIs come. There'll be a part 2 training, again, that's very specific to Delaware. In the afternoon, you're going to go through scenarios. So they'll go through a few scenarios up front, the EPIs, and then you'll partner up and go through some scenarios so you're comfortable doing it. Starting on Wednesday, you're actually going to go live. So Wednesday, Thursday, Friday, you're here, and you're actually going to start doing the calling with someone from public health here to answer any questions. So it's like your practicum, okay? So again, today is part A, tomorrow is part B. Then we have 3 days of practicum, so you're learning in this environment. You're able to ask a bunch of questions, you're a little clearer. And then starting Monday, you'll be at this Deltec, the different Deltec facilities.
Anybody having any difficulty with that? Super. Everybody logged in?
It's not closing. It's
I didn't get a drop down.
okay.
Hey, Cassandra, you might know this since you did this at home. Why are they all having a hard time getting in?
It was a little tricky for me too.
Oh.
It's not live.
Did you already register? Okay.
Yep.
Here, click the.
I love Delaware Stat. And it's like so whenever
Once you fill it out, you can get started.
I'm so excited because the show is
This is where your cart item is. You have to put the cart item underneath actual learning, and then you have to fill out a survey, and then you can start the pre-assessment.
Yes. There you go.
Any of that makes sense. If you have questions, I will help you.
Everybody, can you say it one more time? I'm sorry.
So on that first page, there's like a cart item. It says cart item. If you click on the cart item, then you'll go to a survey that you have to complete, and then you can start the assessment.
Okay. Awesome. It takes an army. Oh, you can do the assessment. We're pausing after the assessment. No, it's down your hand. Stay away. Really good.
So you do like the Nazi.
So, yeah, put it on top. So you have, so do you remember this part, Cassandra, when you took it? How do you make sure that you're...
Oh, yeah, so you do that. So you have to actually, even if the one that you're picking is kind of next to it, you have to move it. You have to slide it so it locks in.
Okay.
So like this, because it is really good information, summary information from each of the lessons and stuff that they can use
Just taking a post check. By show of hands, can folks just let me know who's in lesson 1 right now? Here, get the introduction. I can do the post check sensitivity piece up front on that day, and then they get dispersed with instructions to do it at home.
What about you, Whit?
That's not gonna fix it. I like that. Now, earbuds.
That's good for me. My knees are shot, man. So 10-minute pace is good for me.
10-minute pace. I was like, I can't do it. And then the second mile.
Out and look at camera.